and OT life hacker here. Woo, today was so awesome. My first day or orientation day, whichever you call it. Today I started fieldwork. I started the orientation and it took longer than I thought it would, but I loved the whole thing. It was so awesome. And I'll give you a little rundown on what we did today. So maybe that might be how your fieldwork goes, but again, all fieldworks, all experiences in the hospital, in whatever occupational therapy setting you'll be in, can be different, will probably be different, but maybe there'll be some commonalities between all the different orientation days or how the start of fieldwork goes. And I just gotta say, this is so cool. Look at this, I got my badge. Can you see it? Oh, yeah, that's right. I'm wearing the same clothes because I just got it today. Oh my goodness, I loved everything. So I am doing it in the acute care setting. In this hospital, they have acute care and acute rehabilitation and skilled nursing. So maybe I'll get to dabble in all areas. They have stroke rehabilitation, orthopedics, med surgery, and everything you'd probably find in a big hospital. And I'm saying this is a really big hospital. Got myself lost, but definitely navigating the way through. Basically, I kind of just follow people. But the day started off with, we sat down with the person who's orienting us, and they gave us a binder with all the rules and policies, procedures for the hospital. Should you be absent? The productivity units, that's a big one that we went over. And let's see. Let me check my handy dandy book. Okay. I am an OT student, occupational therapy student. So yeah, so the productivity rules that they have for us in the hospital, and some of the assessments that we'll be using in the setting, and then going over the schedule and any trainings that we may need to do. Alright. But overall, it was mostly about about the structure of the hospital. Documentation was the biggest thing that we covered today. So they were talking about a master sheet that we'll be using to write down who we saw and if we were able to see them or not, explain it, all of that. And I bet many of you are familiar with this is probably common for a lot of people in rehabilitation and hospitals and skilled nursing, the functional mobility status, the acronyms for contact guard, total assist, dependence, all of that, standby assist. That's probably one of the big things that I know I'm going to carry away from occupational therapy school, is knowing the different levels of assistance. It's in PT, physical therapy, and occupational therapy. And then it also has weight-bearing status, which is going to be very useful for those who just had a hip replacement or lower body challenges, surgery, all that. And with me, I brought myself a notebook to take notes. We got to have a tour of the hospital, and again, like I said, it is so big. Hope that I can remember this for tomorrow. Wish me luck, guys. Let's see. Tour of the rehab. So we got a tour of everywhere. We got a tour of the rehabilitation facilities, the skilled nursing, the acute care, and many hospitals. Other hospital that I had done my field work at, they also had, or I guess two other hospitals I did my field work at, they both had med surge, and one of them had a holding tank, so they called it, which essentially was a transition area. So if they're not quite sure where a person will go, what type of care they really need, they will monitor them, so they will be in that transitional phase until they figure out what area to put them in, or what the next best care would be for them. And so we got to look at the electronic medical records chart. I'm so excited I get to have my own access to the charts. Woohoo! So I get to do my own documentation. I'll be like a true OT, I hope. I cannot wait. I'm so excited. The whole time I was there, I was smiling away. I'm sure people saw me and I was just smiling at a painting or smiling as someone's talking about something serious, which is not exactly appropriate. But as you can tell from my excitement, I am so excited to start tomorrow. That's right, tomorrow. Yes. Woo! Okay, and don't worry. I will not come to the patients with all this pep and excitement. I will tone it down, and that's one of the things when I start. I will need to allocate my energy appropriately, so I am not a ball of energy at the first moment, and then days later it will trickle down into not energetic. We don't want that. We want me to be a calm cucumber, well balanced. That's me. Yeah, and so that's pretty much what we went over. The electronic medical records chart, productivity, and the documentation, huge thing that we covered that took most of the day. And the tour of the facilities, we got to check out every area, and that typically is how it works when I've done all my orientations for the other hospitals. We went over all of this. Actually, I take that back. We didn't go over productivity so much. It was more a tour and the rules and the charting system we looked at as I shadowed the OTs. But because this is level 2 fieldwork now, I get to get my hands wet in all of this good stuff, so I will be doing my charting. Of course, the OT is going to sign off, check my work, give me tips here and there. So excited, so dang excited. All right, I am off to post this baby for you guys. So we are in real time, and that's right, tomorrow, which is Wednesday, I'll be starting field work. Yee-hoo, yee-hoo.